BiomedRx Optimum Woman is the only woman's high-potency full-spectrum multiple vitamin supplement to contain 56 nutrients, including those most important for today's woman, such as calcium for bone health, iron for healthy red blood cells, beta-carotene, biotin for nail and hair health, gamma-linoleic acid from evening primrose oil, octasanol, grapeseed extract, a potent antioxidant important for maintaining capillary strength, and vegetarian digestive enzymes. Visit www.biomedrxsupplements.com.
Gold label quality BiomedRx CBD oil is made from organic hemp that is locally grown, glyphosate-free, gluten-free, non-GMO, homogenized, third-party tested, and CO2 extracted. Visit www.biomedrxcbd.com.
Hi, this is Devin Lockett, the president of JobSite Route. As the son of a general contractor, I know how difficult it can be to get good food on the job site. And letting your construction workers leave the job site to buy lunch just takes valuable time away from them being on the site. I've developed an app and a program that will bring a steady stream of food trucks to your job sites every month for the low price of only $100 per month per site. That comes up to about $3 per day to have a steady stream of food trucks coming to your job sites all day, every working day. You can also contact the food trucks ahead of time and pre-order your food from the menu on our app. This saves valuable time for your construction workers and for you. It also sends a variety of delicious food served on Southern California food trucks to your job sites all day. When you think about it, it only makes sense to join the JobSite Route Network. Hello. How's everybody doing? Thank you. Hope everybody's having a wonderful day. Let me make sure my mic level's up. Yes. I hope everybody had a great weekend. I certainly did. Very restful and relaxing weekend after my vacation last weekend with
my son Kai Kai, yeah, we both needed an entire weekend just to recuperate. Vacations are fun and vacations are relaxing, but they're also exhilarating and exciting. So your energy level is high when you're seeing new things and doing new things, and so you have to get a vacation from your vacation when you get back often, right? So how's everybody doing today? Today we're going to discuss biomagnetic pair therapy to address the condition known as bronchitis. Okay, there are many pairs, so I'm probably not going to be showing you on a live model today. My son Kai Kai is at his mother's house resting up, sleeping late, enjoying the last few days of his summer vacation. And so I don't know, maybe if he comes in before I finish this video, because there are a lot of pairs. There are a lot of pairs of magnets that I have to share with you to address bronchitis. So let's see. First, I think what I should do is pop out my chat. There we go. Copy. And let me get my chat situated here. Bear with me, people. I want it to be beautiful for you. There we go. And now I'm going to move this fair use over here. Kind of shrink that down a little bit. Maybe I'll pop it up into the corner here. All right, so now we're going to go to the next slide, and I can share with you the biomagnetic pairs that we use to address bronchitis. All right, and as you can see, this entire desk reference is in Spanish. So bronchitis is actually bronchitis, right? Bronchitis is bronchitis. So let's see how we're going to arrange this. Let me shrink this down like that. There we go. And I wonder if I shrink this, will it change on the screen? Yes, it will. So I don't want to do that. So let's open that back up. And let's address bronchitis. This is the first pair for bronchitis. Antecuerno, antecuerno. As you can see, the antecuernos are the places that you would have your horns if you were a horned animal. Right? Antecuerno, antecuerno. That's the first pair that we would place magnets for bronchitis. Now, one of the things you're going to notice in biomagnetic pair therapy is that the pairs that you're going to be placing the magnets on are going to go in some locations that are kind of intuitive, and it's going to go into some locations that are rather counterintuitive. So it's going to leave you scratching your head and wondering, well, what the hell does this pair have to do with bronchitis, right? Well, it does. It does. Okay, let me pause this music here. All right, yeah, I like the background music too, but I want you to hear what I'm saying, and I don't want it to be a distraction from the pairs that you're learning today. And I also don't want my commercials to come up and take over when I'm talking, because I want to get through this, and I don't want to have to keep going back and forth. Okay, so bronchitis, pair number 2, bazo to bazo. Baso to baso. You see the negative right here, closer to the breast, and then the positive more lateral, or you can say further down, because the patient's going to be lying on the table, right? All right. Next pair. Baso hígado. The baso to the liver. You can see the negative on the liver. Now, as you know, when I'm treating anyone for anything, I usually do the boosts of their detox organs. We call it the top 5 detox, meaning liver, kidneys, pancreas, bladder, and lungs. And I also throw in the large intestine, especially the sigmoid colon, the ascending colon, the transverse, and the descending colon, the sigmoid colon. And I tend to treat the liver with 4 magnets instead of 2, so that I can get the body of the liver as well as the area right above the gallbladder, so that we could purge gallstones. Okay. Bulborachidio thyroides. This is the brain stem with a negative magnet and the thyroid with a positive. Remember, we're treating bronchitis. Bursa to bursa, that is right on the inner arm, right here, right below the biceps. On either arm, negative and positive. Cadera, cadera, hip to hip. As you can see, the negative on the right hip, positive on the left. Pretty straightforward for bronchitis, isn't it? Cardias esophago. Basically, we're going to put this superior and inferior to the xiphoid complex. As you can see, negative above, positive below. When I say superior, I mean closer to the head. That's a medical term, an anatomical term. Carina, carina, right in the heart, carina. Okay, so on the left, the negative, on the right, the positive. Remember, the negative pole of a magnet increases circulation and pH. The positive pole of the magnet decreases circulation, increases tension, and causes a lower pH. Cava to cava. As you can see right there, negative to positive, negative, positive. Codo to codo, elbow to elbow. Negative on one, positive on the other. Chondral to chondral, right below the breast, negative, positive. This is for bronchitis. Ciego, ciego. Okay. You can see where the magnets are, negative and positive. Dorsal number 2 to dorsal number 2. So we're going to place negative and positive poles of the magnet on either side of dorsal vertebrae number 2. Okay, right there at the trapezius. Dorsal to lumbar. Dorsal, they don't say which vertebrae, but I can imagine that's right between the kidneys. To lumbar, and I imagine that's probably about lumbar number 4. Estómago, cola de páncreas. Stomach to the tail of the pancreas. Negative on the stomach, and out to the side, you put the positive on the tail of the pancreas. Looks a little low, but that's okay. Estómago, estómago. Stomach to stomach. Negative to positive. Estómago, hígado. In other words, stomach to the liver. Stomach with a negative, positive on the liver. Estómago suprarrenales. Right above the renals, right above the kidneys, right above your renal organs. So stomach with a negative and a positive right between the kidneys. Or really right between the adrenal glands. Frente pulmones, in the front of the lung with a negative. Suprarrenales, again with a positive right between the kidneys or possibly between the adrenal glands. Hiato esofagio and lengua. Okay, the positive on the esophagus, the negative on the tongue. Okay. You can see they're using the right mandible to access the tongue. Malar, right below the eyes. Even though it says different here. Hiato testiculo derecho. Hiato, right here again at your xiphoid complex, and the right testicle. One moment, please. All right. Business calls, and sometimes you have to answer. So thank you for being so patient. Where am I? We are here addressing bronchitis. The next pair, hypophysis thyroides. Okay, so we're going to place one negative. Now, see, this is a biomagnetic trio, not a pair, because we're going to place one negative magnet on the forehead, and negative and positive on either side of the thyroid. Okay. Hueso hyoides. So basically you can see where this is, and I'm not even going to try to translate that because I don't know what it is. But you can see here where you place the negative and the positive. Don't you love my honesty? Bronchitis. Humerus to humerus. You can see the back of the tricep here is where we're going to place a positive and negative magnet, with the negative pole of the magnet touching the body on the right tricep. Lacrimal, lacrimal, right on either side of the nose bridge. Now, remember, when I'm doing magnets, I'm using magnets on the head. I use the weaker magnets. Don't use the big, powerful. I don't recommend using the big, powerful rare earth magnets or, neodymium magnets. Just use the gray, the regular magnets, as long as you know what side is negative and what side is positive. Okay. Laringe, laringe. Okay. Once again, your larynx. Okay. So the negative right here under the throat, positive a little further down. Mandible to mandible, mandibula to mandibula. As you can see, again, the negative on the chin and the positive right around to the edge here, the edge of the jaw. Mendastino superior, mendastino inferior. Negative on the top, positive on the bottom. Negative on the top, positive on the bottom. You can see right there on the sternum. Mentón, mentón on either side of the chin. And then people say, well, what does that have to do with bronchitis? Trust me. The ear and the kidney on the opposite side. Now, as you know, if I'm going to treat the kidneys, I'm going to treat them both using both positive and negative magnets each, and I'm going to place the positive magnet superior to the negative, with the negative being just on the kidney or the bundle of nerves that controls the kidneys, which are just lateral of the kidneys, and the positive being just lateral of the adrenal glands, superior, meaning closer to the head than the kidneys. Bronchitis. Parathyroides, parathyroides. I believe we've already addressed this pair, but that's fine. This is a little bit wider out. Negative on one side of the thyroid, positive on the other side of the thyroids. Pleura to pleura. This is on either side of the lungs, okay? On this particular pair, being that we're penetrating the entire body, I would use my stronger magnets because it's on the trunk, right? You use your stronger magnets in the larger areas of the body, the trunk being one of them. Supraespinoso, right above the clavicles here, right? Pretty straightforward. Subclavia. Now the subclavia is a place where I place magnets for everyone who has been a smoker of anything, cigarettes, cigars, pipes, marijuana, whatever, because subclavial to subclavial is the circulation that affects the throat, and you can get rid of pathogens in the throat. Okay. Suprarenal positive and todo el frente, all of the front negative. Okay. This is actually very powerful for bronchitis. On the suprarenal in the back, I would place one of my very powerful rare earth magnets. And on all of these negative positions in the front, I would place my neodymium, also rare earth, very powerful magnets. The ones that I got from Spain. Okay, testicle to testicle. Don't use strong magnets. Just use gray magnets on it. Thymus to the baso. Thymus with the negative magnet, baso on the left with the positive. Thyroids to the left kidney. Thyroid with a negative and the left kidney. Remember, I'm going to have both positive and negative, very powerful neodymium magnets on both kidneys anyway. Trachea to trachea. I believe we've already addressed the trachea to trachea, but we're going to address it again. Slightly different placement of the magnets right across the sternum, top to bottom. Vagina or testicles, and the throat, garganta. Vagina to vagina, negative to positive. Thymus to thymus, negative to positive. Thymus gland is a repository for E. coli bacteria. So you would definitely want to focus on that. Thyroid to thyroids, across the thyroid. I think this is the third time we're addressing that pair. Yep, vagina and the throat, or testicles in the throat. We've already addressed that pair. Vagina to vagina, we've already addressed that pair, but you know, you can always visit it again. Now, these pairs are for bronchitis, asthmatic bronchitis, or asthma, right? As you can see, lateral cabeza bilateral and riñón bilateral. So that means negative on both sides of the head and positive on both kidneys. The zygomatic arc and the zygomatic arc right on the cheeks. And that kind of makes sense, right? Chronic bronchitis, once again, carina to carina, and as you know, being that they're on the trunk, I would use my very powerful rare earth neodymium magnets. Chondral, negative to positive, just below the breasts. Heart to the stomach, corazón, estómago. Epiclavia. I think that's the first time I've seen that pair in a minute. Epiclavia. You can see right at the top of the screen, right on either side of the neck, right where the nape of the neck comes down into the shoulders or into the trapezius area, into your traps area. All right? Sternum suprarenalis, right here on the sternum, negative, right above the xiphoid complex, and then positive right between the kidneys or right between the adrenal glands. We've addressed that before. Stomach to heart, estómago, corazón. We've already addressed that pair. Bronchitis in children. Lacrimal, as you can see, either side of the nose, gets things flowing. Bronchitis false with a fever. If you have a false diagnosis of bronchitis with a fever, pleura to pleura. And of course here I will use my super duper strong magnets. And that's it. Those are all of the pairs addressing bronchitis, believe it or not. And so if you have a loved one or someone in your home, someone in your family, or just yourself who has bronchitis, then you can save this video and rewind it. Like I said, it's only 10:56 on the West Coast, and my son is probably still sleeping in. So I'm not going to rush him because he's already taller than Daddy, and I want him to continue to get even taller during this summer of glory. He's having a great summer. He and I are having a great summer. We just had a great vacation. We went to visit the Grand Canyon, and first we went to Mesa Verde National Park in Colorado. If you haven't seen these local treasures, if you're here in the United States with me, then you have to. I mean, you simply have to. You know, I've always imagined the Grand Canyon being just big, dry, dusty hole of brown rocks. No, it is very, very colorful and beautiful, and you have to see it for yourself in order to understand the marvel of it. But here we go. So, what I suggest, in addition to the biomagnetic pair therapy protocol for people who are suffering from bronchitis, of course, I will always suggest DMSO, dimethyl sulfoxide. DMSO is the ultimate solvent. It dissolves fat solubles, it dissolves water solubles, it binds to everything. It changes the property of water. It will carry anything and everything through the skin and into your bloodstream. It also goes across the blood-brain barrier. It is a very good solvent for dissolving gallstones. It is very good for delivering across. It changes the property of water, and it also increases the permeability of your cell membranes. So if you mix a little liquid dimethyl sulfoxide, DMSO, with a little liquid magnesium, liquid iodine, and liquid zinc, and take those four substances under the tongue every morning, it will be very helpful toward you, not only for fighting pathogenic illnesses, right, such as viri, bacteria, fungi, parasites, and even heavy metal toxin burdens, but it'll just help you feel better. You'll feel better. You'll have a greater sense of I don't know, the magnesium helps relax your stress and fights inflammation. The zinc and the iodine do as well. The only problem with zinc and iodine is introducing them into the cell membrane. The DMSO takes care of all of that. Dimethyl sulfoxide also induces autophagy. Autophagy is the body's way of eating itself, or the body's way of discarding damaged cells, and this is the opposite of cancerous tumor formation. So autophagy literally does fight cancer. What I would recommend is, if you're going to take this DMSO, zinc, iodine, magnesium cocktail in the morning, that you drink a lot of water during the day. As you can see, I'm living the BiomedRx lifestyle and constantly imbibing myself with water. If you're going to be doing biomagnetic pair therapy, you have to be very well hydrated as a practitioner, as well as especially as a patient. So your body is going to have a detox reaction as a result of the magnets being placed in the right place. And you need a lot of water in your system in order to expel those toxins. So thank you for watching me. I really appreciate it. The next, we've gotten out of this B's. We're going through the A's and the B's. Yes, I am going in alphabetical order, loosely, but for the most part. But stay tuned for the next video. We are going to address cancer. Now, there are going to be a series of videos addressing cancer because there are many different types of cancer. But the first video, part 1, which is going to be the next biomagnetic pair therapy instructional video I do, is going to address cancer in general, the locations where you place the magnets for addressing cancer in general. And remember, if you're going to do biomagnetic pair therapy, you place the negative magnet where it goes in the pair. Check the feet, to see if there is any muscle, do a muscle testing on the feet to see if there is any tension from the negative magnet to let you know if you've actually found a biomagnetic pair that needs to address. And then you place the positive magnet where it goes, and then you do the muscle test and check the feet again. Go ahead on and hit the like, hit the subscribe, hit the bell for notifications, comment, share the video, and all the rest of that good stuff. And hit me up on Cash App if you like these videos and you appreciate what we do. $BiomedRx. This channel is not yet monetized, but as soon as I get it monetized, we'll be able to do super chats, and then you can donate that way. But this way, if you donate to Cash App, you can also email me, info@biomedrx.tv, and tell me what disease or diseases you would like me to address. You can also hit us up on Patreon, patreon.com/BiomedRx TV, or patreon.com/Devin Lockett. I also would ask you to subscribe to my other Devin Lockett channels, Devin Lockett, Devin Lockett Voodoo Child, and Devin Lockett Reactions, as well as my son's channel, Kai Lockett, okay, because he's a great gamer and he's on live every day. So that's about it. I want everyone to stay kind. As you know, kind is not only the new sexy, kind is the only damn sexy. I want you to stay blessed and stay healthy. I'm going to be going live on Devin Lockett, on the Devin Lockett channel very shortly. Have a wonderful day. Peace.
Gold label quality BiomedRx CBD oil is made from organic hemp that is locally grown, glyphosate-free, gluten-free, non-GMO, homogenized, third-party tested, and CO2 extracted. Visit www.biomedrxcbd.com.
BiomedRx Optimum Woman is the only woman's high-potency full-spectrum multiple vitamin supplement to contain 56 nutrients, including those most important for today's woman, such as calcium for bone health, iron for healthy red blood cells, beta-carotene, biotin for nail and hair health, gamma-linoleic acid from evening primrose oil, octasanol, grapeseed extract, a potent antioxidant important for maintaining capillary strength, and vegetarian digestive enzymes. Visit www.biomedrxsupplements.com.